What effect could marijuana have on your heart? Well, that's a question that's being debated after a New Jersey mom blamed the death of her 22-year-old son on his medicinal marijuana use because she says the drug triggered a heart arrhythmia. Here to help us discuss this story is cardiologist Dr. Kahn.
Welcome, Joel.
Yes.
Thank you, sir.
Dr. Kahn, what are your thoughts on this story?
Well, first of all, the death of anybody this age is tragic. So we have to be sensitive, and my heart goes out to the family because, there's a big void there. But we have it's estimated about 300 million people around the world that are using medicinal marijuana, and we've had very, very few proven cases of heart attack, arrhythmia, or death. So we have to be a bit concerned before we damn the good benefit that's coming out of it.
I mean, the medical examiner in this case did say that he didn't find any correlation between the cannabis use and this death.
This particular case, I think, is unique, and it's possible. The most interesting thing, though, is we have this system in our body that we have receptors on the heart, receptors on the blood vessel for cannabis. We have receptors on blood cells, platelets for cannabis. So it's possible that blood vessels constrict or relax. And we know sometimes blood pressure drops. We know blood can clot. So we can talk about theories, but we can't come to any conclusion on one.
So if anything, marijuana is going to drop blood pressure.
That's right.
Likely.
Yeah, at a high dose that's used for medicinal marijuana, it usually drops blood pressure. A low dose you might find in a joint actually can raise your blood pressure.
If someone is using medicinal marijuana, should they also be consulting with a cardiologist or an internist or a doctor that can track things like their blood pressure or their heart, functioning?
Well, it's a setup question because I think everybody should see a cardiologist because it remains the number one cause of death in America for men and women. But at age 22, no. If I was a 55-year-old man with a beer belly and a history of smoking or blood pressure, it would be good to see a cardiologist under any circumstance. And there has been a little concern in that scenario, or a woman age 58 with diabetes, that there could be a precipitation of a heart attack
but
using
Dr.
medical marijuana. Rare.
Typically, if we see a death in a young adult heart-related, typically it's some congenital thing, correct?
Absolutely. We're thinking thick heart muscle, we're thinking electrical problem, we're thinking a dilated heart, and that's what we don't know for sure. Much, much more likely than the marijuana had an impact here.
I agree. I love medicinal marijuana. I think it's great. I don't use medicinal marijuana because I don't need it.
I know this young lady, and I know you don't use it.
I don't, but let me get glaucoma, and I will use medicinal marijuana because I think it's great. But do you feel as though we have enough studies going on so that we can really find out the different uses of medicinal marijuana, and then that we can look at these potential complications and really identify how many people may have a cardiac problem or may have another type of issue? Not saying that this particular instance should be linked to marijuana, but just in general, how do you feel about the studies that we have in place right now looking at those things?
Well, they're actually pretty good. And, they are being tracked for medicinal marijuana. And again, we really have a pretty good safety record there. There's a better purity. There's not the interaction with other drugs, and hopefully not with alcohol.
So I think this is an important topic, and I think we still have a lot to learn, but we know that there are definitely clinically proven benefits. Right. And in any instance, whether it's medicinal or recreational, you definitely want to use it in a responsible manner.